Welcome, everyone, to a panel discussion at St. Thomas Aquinas College, where discussions about exercise science and health innovation transforming modern wellness will be taking place here. This event is also sponsored by the STEM Advisory Board and the new graduate exercise science programs. I hope you all enjoy.
Before we open, I'm really excited to announce our very first graduate program in exercise science here at St. Thomas Aquinas College. We now have a new master's program, a 33 credit master's program, and a 12 credit advanced certificate. And these really are a demonstration of our commitment here at the college to educating the next generation of exercise science professionals. So we're very excited about this. If you have questions about our graduate program or are interested in applying, you can go see Ms. Dana Kapanong over here. She oversees our graduate program admissions. We have some information here if you'd like to learn more. Without further ado, I would like to introduce our chairman, Mr. Bob Cattell. He's the chair of our STEM advisory board here at the college. Bob Cattell was formerly the chairman and chief executive officer of Keyspan Corporation and chairman of National Grid. Actually, he just completed his term as chairman of the board of the Advanced Energy Research and Technology Center at Stony Brook University and the National Offshore Wind Research and Development Consortium. We are so proud that Bob Cattell is here chairing our advisory board at St. Thomas Aquinas College. And he's been such an incredibly impactful leader here, helping us to grow and to develop and to prepare our students to enter the world of STEM. So I'd like to hand it over to Mr. Bob Cattell.
Thank you very much, Dean Wenzel. And I am Bob Cattell, and as the Dean mentioned, have the honor of chairing the STEM Advisory Board. We had a meeting right before this session, and we have a real great group of people and a lot of exciting things going on here at St. Thomas Aquinas College. A master's degree in exercise science. That's a fantastic accomplishment. A credit to one of our panelists who you'll hear from in a little bit. So I'm just delighted to welcome you here this evening to the discussion, as was mentioned, on exercise science and health innovation, transforming modern wellness. You're going to learn a lot. We are really thrilled. We have a very dynamic panel here, good-looking dynamic panel here in front of us. And they're going to share their insights with you into research and practices that are shaping the future of exercise science, strength training, and really going to be, in my opinion, transformative the way that we live our lives and act our lives, and all really contributing to wellness, contributing to extending lives, and having a very successful and exciting life. The panel represents really a unique opportunity to explore how advancements in these fields, and I learned a lot just a little bit tonight, not only improving individual health outcomes, but also addressing broader challenges like chronic diseases, management, and sustainable wellness solutions. I want to thank the panelists for joining us here tonight. Thank you for being here, the students, the faculty, the community members, and really engaging in a very important discussion. So thank you for being here, and I'll turn it back to Dean Wenzel.
Okay, so I would like to introduce our wonderful panelists, and I'd like to start with our moderator, who many of you might recognize as our very own student, Mr. Tyler Robinson. Tyler is an exercise science major here at St. Thomas Aquinas College. He is pursuing a career in physical therapy, inspired by and has passion for fitness and for helping others. He has gained hands-on experience so far as an intern at Bardonia Physical Therapy and Motion Physical Therapy. He assists with patient sessions and learning the evolving role of physical therapists in recovery and emotional support. Tyler is also captain of our track and fields team throwers group, and I hear he just came from practice. He's also an active member of the Nerd Club, which fosters his interest in gaming, and he plans to build a career as a physical therapist, combining his dedication to fitness and patient care. So welcome, Tyler. Next up, we have another one of our own, Dr. Gabriel Martinez, who is an assistant professor here at the college. He has specific expertise in exercise science and performance analytics. Specifically, he holds a Bachelor of Science degree in Physical Education and Exercise Science, a Master's in Cardiac Rehabilitation and Exercise Science, and of course, a PhD in Exercise Science from the University of Kentucky. Dr. Martinez's research focuses on high-performance training methodologies and occupational readiness in tactical populations, including law enforcement cadets. He brings a wealth of knowledge in strength and conditioning and adaptive fitness to the panel discussion, and we are so lucky to have him here at the college and on the panel. So, Dr. Martinez. Next up, we have Mr. Adam Menner, who is the Chief Operating Officer and Director of Training at Team Varsity House Brands, where he oversees the company's training programs, service quality, and performance metrics. His role ensures that both coaches and business operations thrive, maintaining excellence in athlete development and client engagement. Adam's journey with Varsity House began as an intern, take note, and over the course of a decade, he progressed to co-ownership, playing a pivotal role in shaping the company's growth and vision. With extensive experience in strength and conditioning, business operations, and coaching development, he is dedicated to optimizing training methodologies and fostering a high-performance culture within the industry. So that's Mr. Adam Menner. And then finally, we have Dr. Kristen Reifel, who brings a decade of experience in physical therapy and healthcare operations with a focus on turning innovative ideas into practical solutions. With a background in exercise science and a doctorate in physical therapy from the University of Scranton, she combines clinical expertise with a strategic approach to improving patient outcomes and expanding access to care. Currently completing a master's in healthcare administration, Kristen is driven by practical solutions to reduce things like burnout, to improve access, and to make wellness sustainable for both patients as well as for providers. Kristen Reifel oversees Valley Hospital's 3 outpatient rehabilitation locations and the Chiropractic Center for Child Development. She is also involved in the repurposing of the former hospital, the Ridgewood campus, into a hub for outpatient services as the Director of Operations. So that's Dr. Reifel. And now that you've heard about all of our panelists and our moderator, I'm going to give the mic over to Tyler, who will begin with our questions.
Thank you very much. I'd like to open up with a more general question, and then from there we can get specific. So for the theme of the panel today, it's going to be innovation in exercise science and health. What do you think has been the most transformative advancement in your field over the last 5 years?
So one of the things I think that's really been growing in the field is the utilization of technology with everyday training. And with this kind of information, we're really able to not just monitor how well someone is performing, but really look into some of the physiological aspects that people are experiencing, and we can help manage, at the end of the day, stress, really guiding how well someone can perform. It's guiding, things like development into chronic disease. So just the accessibility of that, its use is, I think, one of the biggest things that's come out of the last 5 years or so.
Yeah, obviously, I'm going to look at it through the lens of where I am, right? So Varsity House is just a privately owned facility, meaning that we make the rules. So we're trying to sanction those rules. But when I look at this question, and I see a lot of you guys here just speaking to the audience, if you will, we are trying to strive to provide long-term careers in the industry through an exercise science degree, which I think is pretty special. So meaning your ability to help people get results, whether they're athletes, they're adults, they're young kids, we are literally trying to turn that into a long-term career where you get health benefits, a 401k, and you get to make a living off of literally being in sweatpants. I'm dressed up for that. But being in sweatpants and truly helping people. So that advancement in itself, through your own training, knowledge, and education that you get here, could provide you with real income.
So I'm a physical therapist, and I would argue, physical therapy as a practice is now an entry level, you have to have a doctorate for entry level. The way physicians now rely on physical therapists to really diagnose, it's very different than what it was in the past. So you'll have, in New Jersey and New York, you have direct access. So you can come off the street, you can go into an outpatient clinic and you can say, hey, what's going on? And that level of personalized care with therapy diagnosis is very, very different. Obviously, since COVID, we have a lot of technologies coming out, and the volume in hospitals and all sorts of practices is overwhelming. So using technology to, leverage that and capture it is a big difference.
I like the different perspectives given there, all kind of tying into the accessibility and practicality of the field. For Dr. Martinez, your research focuses on high performance training for tactical populations, like law enforcement cadets. How can some of your methodologies you've utilized for these high stress environments be adapted to benefit the general public looking to improve their health and fitness?
So to talk about this, I'll talk briefly kind of what I did. So with my research, what I was working with law enforcement cadets going through their training program to become officers. And with previous research we've done, we found that through their fitness program that they already had, there were some needs that needed to be addressed so that they can improve things like upper body strength and so on. So the idea going into working with this group was, how can we take methodology that is typically used for athletes and really focuses on individualizing the training loads, the work that they do, so that they can see the benefits for their program, so they can be successful to become an officer. And interesting, what we saw is between the stuff that I had worked with and the standard program, there really wasn't a big difference in improvement. Both programs worked. But the biggest thing we saw was when we look at some of the physiological, the stress part of it, they did the same performance with doing less work. And also, we saw that they also had less injuries that were occurring. So the point with that is, if we can use methods that we can manage stress. So stress is either going to allow us to become stronger, become better at our performance, or when we're overstressed, we get overtrained, we get sick. If we have ways to measure this, regardless of the population working with general public, if we can manage this in our training, we can really see good benefits in our overall health. And I think that was kind of one of the big takeaways I was able to get from working with this group.
Nice. How do you approach teaching exercise science to inspire the next generation of professionals in the field? If you could, share some specific teaching methods or examples that have been particularly effective in helping students bridge the gap between theory and practical application.
Anytime I teach, I kind of think about my journey within exercise science. And it was longer than I anticipated to be when I first started. I didn't really know what I wanted to do even when I had my bachelor's. But through working as a trainer, through teaching, through doing research, I found that there was a lot of core skills that if you can develop early on and reinforce them through a program, then once you graduate, you can be really successful within the field. So coming here to STAC, that's been my kind of goal. Every class I teach, even if I taught it multiple times, I'm always trying to improve it. And the biggest things I try to do is what experiences can I provide for you as a student to apply this? So what's different in different classes? For nutrition, it will be doing a diet analysis using some type of program. For testing and prescription, it's, how do I assess body composition? And how do I do it utilizing a lab method? How do I do it using a field method? Being as experienced as possible with as many things as possible. And then how does this kind of come together? What I hope to. Last semester, we had 2 events. They were something that myself and my students of 2 classes, we worked together to develop. The first was a health assessment event. So students of my adaptive fitness class, we set up in our lab in the wire Tyler was there and was very excited to be part of this. We had students, staff come in, and they ran health assessments. They did things from blood pressure, body composition measurements, all of the assessments on their own, interpretation, everything on their own. And we did this last year, but from last year to this year, we increased the amount of people that we saw. So we're getting out there and showing that application. This year, for the first time with my strength and conditioning class, we similarly did an assessment for different athletes. Now, this one was a little bit of a challenge, but we figured out two groups that we're going to work with. As a class, we discussed what are the demands, what are the things that are important for that sport, what do we need to test, develop the tests, ran the test, and then afterward, we took that information and we evaluated. We made it in a way that can be presented like a dashboard for the athletes. And we also on the back end did some statistical stuff just to see what other things we can get out of it. So the big part was really, building all the knowledge and skills to get to that point. Because at that point, you can apply to the different fields that we all represent.
Learning the subject matter is one perspective, but being able to actually put it to use and do things hands-on gave a whole new level of understanding that I didn't initially have going in. So thank you. For Mr. Adam, as a leader in performance training and business operations, what are some of the biggest misconceptions about strength training for both athletes and general clients? And how do these misconceptions overall impact health?
How many people in here work out? How many people in here train? Tyler, what's the difference?
Training is a lot more specific, has more specific demands compared to just overall working out, I think. Yeah.
For sure. So training is when you have a specific goal. So if you're an athlete in here, hey, by this date, I want to hit these metrics, and you reverse engineer that with what's called programming based upon methods that you learn in exercise science. Working out is, let me see what's going on in women's or men's health here. 100 abs in 100 days, I'm going to look like Tom Hardy. That's working out. There's no plan, there's no rhyme, or there's no reason. If I was to say, how many people in here could bench 315 pounds or squat 400 pounds? Raise your hand. That's what I'm talking about. But how many people in here can do 10 strict push-ups on the ground? Right, good push-ups. So if I was to get you right here, look at your technique, we're all going to grade you right now on a scale of 1 to 10. No, I'm just kidding. Here's the reality. One of the biggest misconceptions is you learn so much as a young student and you take in all this information. I said downstairs in front of the board, I've been very, 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 very lucky. I've trained your favorite NBA athletes, NFL superstars. I've trained mom and dads, little kids, it doesn't matter. But meeting that individual where they are with the demands that they need is the biggest misconception. You could read the most advanced things in exercise science, which are important, but it's the applicability of using that to the person that you're working with. An example is, if I see LeBron James walk in the door, or I see a woman who's 25 years old, she's afraid of working out, she's a little timid, the methods that I use on each of them are going to be completely different despite how much knowledge that I have. So your job as an exercise scientist is to prescribe the best programming that meets those individual needs and makes them feel really comfortable. And so the biggest misconception is that less is more, and meeting people where they're at is more important because you get the number one thing that matters, which is adherence and consistency. If I was to write the same program for all of us, all 50 people in this room, whoever follows the program the best is going to get the best results. It's just period, point blank. And you could say that about anything, your academics, you could say that about your life, your personal habits, your skills. So the biggest misconception is meet people where they're at. How do you decipher all this information that you're learning in really good classes and people who are very smart? And how do I dumb that down to the individual that I'm working with? Or how do I scale that up to meet this individual, LeBron James, who's walking the door, who has way more on the line? So.
I thought about it like that. Thank you. And as the director of Training and CEO at Team Varsity House Brands. You oversee both coaching development and business strategy. How do you ensure that the latest advancements in exercise science are effectively integrated into your training programs while maintaining a successful commercial fitness operation?
So as we alluded to before, is if you were to work for a professional organization, so let's say you were to work for the NBA, your sole responsibility as an exercise physiologist is to get results. That's it. So it doesn't matter how long, what the time is, when they do it, it doesn't matter. But we are a private operation, so we have a business to run. So obviously profit matters, paying our employees matters. So in the private sector business, schedule and capacity matter a ton. So all the ideas, the seminars, the things that we speak on, information that I learn, where we go to travel to gather more information, I look at it through the lens of how can I take the most important things and provide it to our clients in a way that aligns with our business. An example would be if I know that we run our sessions. So we have 56 classes that are available for adults and 32 classes that are available for athletes in the schedule. If I only have an hour and I just read something that Dr. Martinez put out, okay, this eccentric loading, I have to do this. That session could be 2 hours. I'm gonna start putting on music, I'm gonna put on Drake, we're gonna have a good time, we're gonna get after it. But then this next wave of people are coming in, and this next wave of people are coming in, it's like, oh shoot, I can't do this anymore. Okay, so what's the most important here? So taking that information and making it applicable to our business to ensure that trains are on time, if you will, is very important. So when looking at it through the lens of business operations is, here's the information, here's how I get results with our individuals. Now, how do I take that and fit it into what's actually happening in the business to ensure that everything is running smoothly and no one kind of does this a little bit. So a lot of it is just providing guardrails with the information and getting results within the time allotted.
As someone deeply involved in rehabilitation and healthcare operations, how do you see exercise science evolving to address the challenges in chronic disease management and patient rehabilitation?
So I think we could probably all agree that prevention is best. Unfortunately, physical therapy by its nature is very reactive, right? You have your injury, you come to us, so we're not really in the field of prevention as much as I would love to be. Where I would argue exercise science is really this interdisciplinary approach that I sort of mentioned before. So I'm a vestibular nerd. Do you guys know what the vestibular system is? Anybody have vertigo, dizziness, balance issues? Yeah. So this vestibular system is really what, is a great sensor in your head that tells you where you are in space. It's a big balance system. And I'm sure you've seen or heard about concussions if you're into sports. So from an interdisciplinary perspective, if somebody has a concussion and you come to me as a physical therapist, I'm really just treating the symptoms that you have, right? The symptoms of dizziness, the symptoms of imbalance. But what do we do with that? Because if you're asymptomatic, you still have to go back to school, to work, to sport. And that's where an interdisciplinary model can really come in. We would love to have, handoff with athletic trainer, exercise physiologists, where we can really bring you back to what you do. So that's just one example how interdisciplinary care is really the answer to that, in my opinion.
One of my favorite things about the field, I feel like you always get a new perspective or something new to look at that you might not have thought about a week ago or a day ago. What role can physical activity and wellness programs play in improving the well-being of providers themselves? And how do you implement these programs at Valley Health System?
I mean, the simple answer is the more resilient you are, right, the more you move and jog, the more resilient you are, you're going to do better, you're going to burn out less. But I think the easiest way to picture it is just have fun. What prevents burnout the best is having fun. So at Valley, we really try to stress that. We have a whole committee called the Vibe Committee, and it is truly dedicated at setting the vibe. So we will have managers required to create breaks in the practitioner, whether it's a nurse or a physical therapist day, so they can go down and do bobbing for apples, for example. So it's really fun, dumb things that really shake it up, but truly to combat burnout, arguably other than staffing ratios would be to help just have fun. Even going out axe throwing, doing something strange like that with your team and team building is really the answer. So we actually did a study where we had people who participated in Vibe. They had to answer certain things, gratitude questions. And the study actually came out that the more fun you have, and the more you actually dedicate to fun, which may seem like conversely related to productivity, you actually get a lot more out of people. And you build a lot more trust in your teams, and retention is better all around.
Thank you for that. And then for anybody, collaboration is key to advancing wellness. What role do you think interdisciplinary partnerships play in shaping the future of the field?
I think that the interdisciplinary approach is really important because, we, a lot of times with our specific professions, we tend to look at health in a singular lens. And unfortunately, that's just how the body works, right? It's not just one thing impacting the other. So, even with us, with this group, we may work on some research, and that needs to be useful so that it can be applied in the actual field. And within that, is that going to be applied, and is everyone going to do it, regardless if they're an athlete or if they're just, general population trying to get healthy? So I think it's hard because a lot of times it's hard to get the message clear between all the different groups. But, working together, understanding everyone's roles and how they can benefit and work with each other, I think it's really important to at least, developing this relationship that will lead to health benefits.
Yeah, this is actually a really good question because you look at, again, just looking at it through our lens, but I agree with you. As a business, if we're trying to also be innovators in private sector health and fitness, if you will, I mean, we're going to service in the next 2 years over 1,000 families in Rockland and Bergen County alone. And so one of the things that we're thinking about doing is how can we provide a service offering, such as like a small group or private training, or what have you. How can we provide something that is science-backed and also PT health-backed? So what we're doing is we're actually creating a holistic program where, I don't know if you guys have ever seen, I don't know what the name of it is, but you can basically go and get all of your blood markers done. You can do, basically, it's just like a whole health check. And so we're partnering with these organizations like that. There's one, I forget what one of the names are, but essentially you go in, you get assigned a PT, you get assigned an exercise physiologist, they take all of your health markers and your tests, then they make recommendations for us, and then what we do is we're going to put together a program for that individual. So it's actually backed by their own internal data. So hey, cardiac, your respiratory, the bruise test, all these different exercise tests that you take, that allows us as programmers to put that in, take that information and make a program that's actually specifically tailored to you. So as we continue to go here, that is going to be the future because I agree, health and wellness is your longevity or your lifespan, as we like to call it.
So it's really just getting everybody on the same page. So what's music to my ears if I'm treating a patient and I'm like, okay, I'm going to have you do this, and that patient say, oh yeah, my physician said that. Oh yeah, my personal trainer said that. You'd be surprised on how many people shop around for the answer that they want to hear instead of the answer that they need to hear. And making sure that we're all on the same page and we're all moving forward together is really best practice.
I wholeheartedly agree. I mean, as much as you just said it, like I do get nervous when I hear something and it doesn't necessarily make sense to me the first time. But even if the message is the same, hearing it from a different person or reinstating the important things that need to be done within different aspects of exercise science, I feel like we'll go a long way. For the next question, what advice would you give to college students, such as myself, or young professionals interested in pursuing careers in exercise science, fitness, or rehabilitation?
So for this one, and I think this can apply pretty much to any major, find your passion. Find what really drives you, because in exercise science specifically, you can work in all our different fields, working with vastly different populations, doing completely different things. But if you don't enjoy it, if you don't have a drive for it, occupation is a huge part of your health, right? This is something you're going to potentially for the rest of your life doing. So if you don't enjoy it, it's going to impact your health. So find the passion in what it is, and from there, just drive it. Do everything you can to foster, the education, the experiences, and most of all, network. Talk to other people. It doesn't matter who it is, but grow that network, and from there, you never know what possibilities come out of the field. That's my advice.
Just look at the particular sector that you want to be a part of and who is in that industry, and try to attach yourself to that individual. So, engorge yourself with all their information. I don't know if you guys know who Joe DeFranco is, or Eric Cressy is, or Mike Boyle is, all these famous names in the industry. These are literal strength and conditioning legends, no matter what our discipline is. And so if you see that, read their articles, listen to their podcasts, take notes, apply. And the number one thing I will say, just to wrap this up, is experiment on yourself. You cannot be an exercise science in the field training and doing things if you're not doing it yourself. That's why, I joked, but I seriously asked, is like, how am I going to tell this dude to do X, Y, and Z if I've never done that? How am I going to help this woman lose weight if I've never done my own weight loss journey? And so putting yourself in their shoes, not only sell it, but you're speaking the truth. And so all this information that you're learning, you're applying, and that makes you a better technician as well.
One, keep an open mind. I didn't know what I wanted to do. I kept an open mind. I ended up in exercise science, and it opened up a lot of doors for me. And now in my new role as director of operations, another door, I kept an open mind and sort of let it flow. So find your passions, but keep an open mind. The other thing I would say is work on your emotional intelligence. I don't know how much you guys are exposed to that as a concept, but Adam talked a lot about it when it comes to meeting people where they are. Emotional intelligence will have you be successful in whatever endeavor you try to do. If you're really interested, Harvard Business Review has amazing articles on how to do that, and I would probably say that would be my top step.
Thank you. And then speaking from my perspective, at least, having an open mind and being willing to try new things. I originally didn't first know that I wanted to be a physical therapist. I actually started as an accounting major, and it was only through giving myself the patience to maybe this is the right route and being open to trying new things that I was able to find something that I was actually passionate about, and it's okay. And finally, for the wearable technologies such as data analytics and analytics, how do you see those influencing the future of exercise science and health innovation?
I think what's really just going to happen, a lot of this technology already exists, and it does a lot of times require a lot of background, a lot of statistics, a lot of just background things to do to actually pull some information out of it. So what I think what's going to really end up happening is that things like AI are going to be supported and integrated into some of these metrics, and that's what's going to really be used to guide some of the things that we're looking at. And the pros and cons of that is maybe we can get information that is useful for us right away. We're working with someone, we can see it, we can use it. It doesn't waste time, so it's applicable. On the other hand, too much of that may take away the part of strength and conditioning, of personal training, of working with people, and kind of maybe take away some of that connection that when we're trying to build relationships and trying to change these behaviors to get people to get healthier, we want to keep that contact. So we don't want to just rely on that solely. We want to still maintain those things. So, again, I really think technology is just going to be integrated more. And I hope that the information that's useful for us is things that for us as practitioners, as researchers, that we can move the needle forward on the field even more.
Yeah, for sure, I agree. I think too, when you look at data, in a lot of these studies, it's in controlled environments still. There's still evidence, just obviously being in the field, but we like to say empirical experience, whereas I worked with literally 20,000 people over last 15 years. This may work, this doesn't work, but that doesn't mean that data, it doesn't mean that data is not important, but I think that we need more data on everyday people like ourselves, people like you guys who have stresses, school, class, work, all these different things. I want to see, when you're still working out or training for a goal, I want to see that data. And I think that data will provide us with a better picture of, you talk a lot about it, but stress mitigation and what that looks like in someone's everyday life. And how for us as exercise scientists and practitioners, how we can actually take that information and prescribe real programming that gets results over the long haul, not just in the short sprint. So.
Technology's there, it's not gonna replace, right? It's gonna be an adjunct. Technology can tell you what you've done, but it's not gonna have that skill, that skilled service that you provide. So I'm thinking, again, PT brain, right? If I'm trying to get you to contract, I'm gonna actually tap, I'm gonna facilitate. Technology's not giving those cues. So leverage it. If people are buying into it and they love it, meet them where they are, have them show you their data every time they come in. It's just make sure that you're integrated.
In a world where people are overwhelmed by fitness trends and misinformation, how can professionals in your field better communicate the importance of evidence-based practice in public?
This one's a difficult one to answer because this is their reality. Anyone can say anything, and we can believe anything we want. So there is a lot of information. We have years and decades of the benefits of exercise, and we know this. I don't know if there's a really good answer to this. I just think if we can just be consistent on the message at all different levels, whether when we are talking to children, whether as adults, whether as older adults, if the message is the same and progresses as our knowledge does, then I think maybe we can get more people, buying into this. And really, as Adam's been saying, is taking control of their health. Fitness, nutrition, these are our two things we have the biggest control over that have a significant impact on our longevity. So as long as we can control it and understand that, then we can kind of do better for ourselves. So that's just, integrating it just more and having that consistent message throughout our different lifespan. I think that's going to help.
For sure. Mine's silly. Train yourself and train people. That's it. If you want to learn more about anything, train somebody or a group of people for not 1 year, for 3 years, 4 years, 5 years. Train yourself for 1 year, 3 or 4 years. You will see and learn more about yourself and the information that you're intaking, and you'll be able to decipher much better because you have the lens of, like I said before, empirical experience. My secondary, and it sounds silly, but it's true, is get off social media. Seriously. Just in terms of the information that's being displayed, a lot of those influencers and people that you like, we've seen them, I've talked to them, we know them, and they don't train a lick. And so get certified, do what we're doing here, get boots on the ground, get experience, train yourself, train people, and that will tell you more that you need to know than any textbook. So.
But everybody wants the quick fix, right? They want the pill that's going to solve it or the surgery that's going to do it. And unfortunately, that's not the case. Health takes work and it takes consistent work. And that really should just continually be the message.
I heard that they actually came out with a pill that instantly gave you that. No, you're absolutely. I think you hit the nail on the head right there. Those insights are very reassuring for the future that's to come. And for my final closing question, looking ahead 10 years, what is your vision for how exercise science and health innovation will transform not just the individual wellness, but also community and public health?
I think really just kind of summing up the different parts we've already discussed, I hope in 10 years that we do have a more holistic approach, a more interdisciplinary approach where we can go in, just like we go to doctor when we're sick, we can go in and make sure that we're addressing all our aspects of health, whether physical, whether mental, whether anything, so that we can live the best life that we can. And I think, with the information that's there, the technology, and the push of a lot of individuals within the field, I do think we can get there. So I think just that kind of interplay of everything working is what we need to see, in the next decade.
I said this downstairs, and I'll say it again up here. Your health and your well-being, mental, physical, is the two variables that you can control in this life. I truly believe that. So, sorry for our professors and teachers here, but you could study all you want. You could get perfect grades, but you might not get into that dream job. You could take that dream job. You could do everything they tell you to do. You might not get that promotion. You could do all the things that you want to in this life that they tell you to do, and you still might not get the outcome. But there's one guarantee that if you eat healthy, relatively, you don't party your face off, I've been there, and you train consistently, you will get results, and you can expand your lifespan. And knowing that information, I'm sure you guys have seen being in this department, where our health is headed as a country. And so if you are an exercise scientist, whether it's in the trenches, whether it's coaching people, whether it's rehab coaching people, we have an obligation to literally make a difference in people's lives to the one thing that matters. And so I'll end with this is if you enjoy doing that and you believe coaching is a calling, this is 100% the industry for you because you're making a difference in the one variable that actually matters, your life, So.
What they both said, both excellent points. And what I'll say is I'm starting to feel like we're cascading towards that. You know, people are starting to look at things a lot more holistically. Even like the field of rehab, you used to go, you know, you had knee pain, you'd go there, look at your knee. Now they're looking at your shoulder to your knee because of the lateral sling. So there's a lot more of a holistic approach, and I think people are really starting to look at everything. You know, what are the ingredients in their food, the whole picture. So you should
Feel all jazzed up, feel like I'm gonna nice little hug after everything, so like that. Thank you guys so much for answering all the questions that I had lined up here. I feel like it added a lot to the conversation that is going to be had today, tomorrow, and upcoming years. So thank you again for that. Now I wanted to open up the questions to the audience. Is there anything that inspired questions?
Hi. So this question's probably more for Adam. So, when you, this kind of goes with physical therapy also. So obviously, if you go to physical therapy, usually you have like an initial eval and stuff like that. So if you have like two athletes who, let's say I'm a thrower also on the track team. If you have two throwers who are coming to you for training, you don't know anything about me, let's say Kyle, you know nothing about Tyler. Do you have like certain tests and programs that you'll put us through first to help develop your program?
Do you bench more than Tyler?
Yeah.
Okay. Tyler's not welcome. No, I'm kidding. That's a great question. Yeah, no, that's like an assessment. So I mean, you talked about a physical assessment. You have physical assessments as well, and so that's just a basic way to see where you're at from both a movement standpoint, like movement competency and how that affect your performance, but also a fitness level. So, you know, one of the words we use a lot of is like novice, and then there's like a novice advanced scale. So that I keep joking, but if you were to come into the gym, a lot of people say, yeah, I train, I work out, but I would be the judge of that, just in terms of what your expectation is, and like your true fitness level is not as great as you might think it is. And so we put you through a whole test, ask questions like you were referring to. It's like, hey, what's your diet like? What medicine are you on? What's your stress level? How are you sleeping? So that's more like mental stress. And then it would be biomechanical. So it's like, hey, how are you moving? What limitations do you have? And then it's physical. It's like, all right, let's put our money where our mouth is. Let's go on the training floor. Let's see what you got. And then based on that information, that is how you create a really good program for somebody. Does that answer your question?
Yeah, cool.
Thank you.
Hi, my name is Lila. I'm also an exercise science major here at SEC. And for me, I'm trying to still figure out what I'm going to do with my life. And I'm kind of thinking that exercise science can be kind of like a jack of all trades. How do you suggest moving forward exercise science can help benefit you when you're still trying to figure out what you want to do with your life, but you have interest in all these broad categories such as rehabilitation, physical therapy, strength and conditioning, and stuff like that? And do you think that for a business opportunity at some point, you would be able to combine all these opportunities to make one big facility to help overall help with general wellness? Okay. Well, I would say get exposure. So if coursework is going to teach you certain things, but check it out. So even in physical therapy, a lot of schools require a certain amount of observation hours into the different areas, but, and I particularly say, go look at different areas, right? In physical therapy alone, you could be an outpatient physical therapist, and even there, you could be a vestibular specialist, you could be in neuro, you could be in ortho, you could be in sport, you could be in pelvic floor, lymphedema. You could really dive into it. But do you like it? Do you want to be an outpatient? Maybe you want peds, maybe you want inpatient. I think exposure is going to be really to see what you want to do every day in and out, which was earlier advice. There was another part of the question that I'm not answering.
Yeah, it's just along the lines of, for business opportunities, you think it would be easy or possible to combine these ideas into one, such as having your own gym as well as having rehabilitation on the side and kind of make it coexist together and have one kind of broad general wellness?
It's great. And they exist. There's a bunch of different kinds and different aims. At Valley Hospital, we have the Wellness Center in Mawa. It's not necessarily geared toward an athletic population. It's more of a wellness for a geriatric team and people who are suffering neurologic conditions. But we have the hub of everything. So in that building, we have exercise physiologists, we have athletic trainers, we have cardiac rehab, physical, occupational, and speech therapies. We have physiatrists and orthopods. We have diagnostic imaging lab and pharmacy. So they do exist, but I think if you're looking, each kind of, I guess, place has a different, feel or vibe to it, right? If you walk into the fitness center associated with my outpatient rehab center, it's going to be nothing like what Adam has. So different models, it just kind of depends on the vibe you're trying to get.
What was your name? Lila. Google Emily Neff for Relentless Athletics in Hatfield, Pennsylvania.
I have more of a general question of how would you recommend getting starting off in the field of exercise science? Obviously school, internships, stuff like that. How would you recommend someone who doesn't know exactly what they want to do in that field? What would you recommend they do?
First steps would, if you really have no idea, so first, figure out what are the different things you can do. As was started, being a part of it, whether it's going to a gym, whether it's being active in some club, that could be a starting point to say, okay, I like working with physical activity as a mode of some sort. From there, kind of working on where do I find this passion, you typically figure out what kind of groups you want to work with. So, for example, some people really love healthcare. People really want to work in the rehabilitation setting, and that's really what their calling is, and not necessarily working with athletics. So you typically have a general idea of the population you want to work with, and then you start kind of gearing the experiences that you want to go towards that. Now, if you're still not sure, as we were suggesting, you have to kind of shop around. Do a little internship at an OT place. Work in a fitness facility for a little bit. Be a part of campus health, things like that. And then from there, you'll start really just figuring out, what's calling you, what's driving you. And that, at least in my experience, that's people that have done well in the field, that have been successful, that's kind of how it starts for that. That would be my recommendation.
Yeah. Hi, my name is Ethan. I'm also an exercise science major. Going off of Lila's question, I also want to open up my own gym and physical therapist clinic, more for sports medicine athletes. I just want to ask both Dr. Raffel and Mr. Miller, on a business standpoint, how would you go across opening one of those places?
Start super small. So I think the first thing to do is, especially when you do a combination of sports performance training for athletes and then rehab. Do you know guys like Eric Cressy? Do you know who Paul J. Favorites is? Okay. So like that. So one guy was super specific in baseball, the other guy was super specific in basketball. So niche down to an individual population that you want to work with, and then start super small. So maybe you lease space. I don't even know the whole blueprint here, but we could talk after. Seriously, I would just start smaller, lease space, keep your overhead very low, and attract a certain clientele. Get really, really good and build your repertoire there, and then from there you kind of begin to expand. Because that bridging the gap is very powerful, because not a lot of people do that. But if you're trying to appeal to everybody, you're going to appeal to nobody. So it's if you love track and field or basketball or whatever the case may be, it's go all in and do that thing, if that makes sense. Yes, sir. Thank you.
You're going to be your own brand. So every private practice that starts off small and in their own, everything Adam just said, but you're going to be your brand, and you're going to develop relationships, and people are going to trust you because of that. And then as you grow and expand, people are going to expect you to maintain that brand. So again, I go back to that emotional intelligence piece, because you want to have relationships with your referring providers, and you want word of mouth to come out of what you do.
We're going to take 1 second to there are people viewing this live on Zoom right now. We have an NSF program with other colleges and universities that are tuning in. I just wanted to check the chat and see if they have any questions. We have a question from our LSAM student, Daria Thomas. The question is, do you guys work out or train almost every day? And if so, what kind of workouts do you do?
You wouldn't know it, but years ago I did actually train much, much more than I do now. And I'm not going to put any excuse to it, but when life happens and when I need have a family, get married, have two little kids that drive me crazy sometimes, it's really hard to balance everything out. And not only just balance out and figure out when you're going to do it, but really managing all of your stress so that even when you are working out, you see the benefits of it. So for me personally, the last few years has been a little bit more of a struggle for me, and I'll be completely honest about it. You know, I finished my PhD when COVID happened. I had my first kid when COVID happened. I moved. I started a new job. You know, a lot of things happened. So I train when I can. Right now, 2-3 days a week, I do a lot of stuff at home, and I just try to be as consistent as possible. Is it perfect? No. You know, I know this, and I keep myself accountable to it, and I really do drive to keep pushing and pushing it forward. And in time, I'll get back into where I would like to be. You know, years ago, I did, you know, talk about speaking from experience. I competed for strongman for a little, just for fun. You know, it's something I did just because I wanted to do something active, wanted to kind of just see something new, and did. I'll like to do it again. That'd be great. Yeah, so that's where I am right now.
Yes, I train every day, and I agree though, it varies in intensity. So I was just on Kristen, I have a 3-month-old baby, so that's been fun. But yeah, I train every day, and I have a goal of doing a triathlon in Hawaii in 2026, so that's going to be fun. But just in terms of, yeah, you have to figure out the balance of what works for you, and I think the consistency factor of it, because you got to remember too, for you guys, everybody has a lot on their plate. If you're in school, it's like, okay, you're playing sports, Tyler was coming from practice, he's doing this, he's probably going to study. So you have to just figure out, you know, your schedule and what works for you. And my tip there, because I tell everybody, obviously, that comes to the gym, is make it a non-negotiable on your calendar. Like a class or a time slot lives on your calendar. You wouldn't not show up to class, or maybe you do. But it's the truth, like with your fitness, where it's like, hey, Monday, Wednesday, Fridays I'm just making something up at 2 p.m. I work out or I train from 2 to 3. That's my time. And once it lives on the schedule, it takes 21, 30 days to build a habit, and you just get the ball rolling a little bit. But to answer your question specifically, my training is wild, all over the place. So
I do more of like mental health. Like I think of working out as mental health. So like I'm doing more like yoga, things that I can help, you know, relax and calm my brain. And then and I have 3 dogs. I adopted 2 puppies, and they're insane. So lots of dog walks.
Very good. We have another question here from a very familiar name. We have a Ken Daly here. President Ken Daly is tuning in, and his question is about careers. So to give some clarity about what kind of careers does exercise science lead to, and also what does it not lead to that some people might think it does?
This was an interesting one because unlike some other professions, you know, you need to have a specific degree or a specific license, and then you can thrust yourself into that field. With exercise science, I mean, there's such a wide range of things we can do. And at the moment, and I'll just say this, you know, whether it's good or bad, the barrier to entry to get into it is very easy. You don't need a college degree. You need, you know, certifications pretty much are recommended, but, you know, you can get into this field very, very simply, very easy. Now, to be good in the field is a different story. And I think one thing that is actually happening is we are seeing the growth of the field, a growth in the certifications, the requirements of these certifications for fitness professions. So someone coming out with a bachelor's, for example, they can run a fitness or wellness type of business, and they'll be well suited towards working with the general population. What additional schooling really tends to do is make you a specialist, really make you focus on healthcare, you know, focus on performance, focus on research if that's what you're interested in. But it's really hard to say. There's a lot of different things you can do. You know, I've known people that have done from physical therapy to occupational therapy, personal training, massage therapy, chiropractic, dietitians. There's so many things that are just involved because at the end of the day, it is a real interdisciplinary field. So there's a lot of options out there. It's best I can put it.
Yeah, it's a great question. I mean, you hit the nail on the head. Is the barrier to entry is super low, right? If we wanted to be doctors or surgeons, it's very respectable. And again, I keep saying lens because I'm just speaking from my experience. But you know, my parents still ask me if I'm going to get a real job sometimes. But the truth is that because it's like, well, we're not a doctor, or I don't have my doctorates in PT, or I don't work at a school or institution. But it's, you know, not to toot our horns, not me, but like as a company, we see literally tens of thousands of people a year. So it's like my experience, and yes, I have certifications, is very, very high. However, to answer his question directly, is when you think about careers, what we are trying to do is we're trying to take people like you who like fitness and want to change lives and build long-term careers for them. And so imagine telling your parents, and I did, and saying like, hey, no, like I'm going to retire doing this because I make enough money to do so. And so we're doing that through the question that we said before is combining the business knowledge with exercise science. And at the root of it, it's helping people. And so my advice is, just like you said, is get very good at that one thing, see it through. And then within private sector fitness is we are providing the way to do this for the long haul if you're interested in doing that.
And I'll just say, I graduated with an exercise science degree, and I'm doing so much project management right now. I'm learning about Department of Health inspections and floor plans and DCA. So when I said keep an open mind, if you had asked me when I chose exercise science, when I declared, I would have never thought I would have went into physical therapy. I would have never thought I went into leadership, and I would have never thought I went into what I'm doing now with the repurposing project.
Very good, thank you. I'm going to take one more question from our chat here, and then we'll come back to the audience. So we have from Carice Mitchell asking, how do you individually or personally apply knowledge that you've learned in other fields to your own jobs, your own careers?
Years ago, I worked for the Y, and I kind of worked myself up into a supervisory role. And for me, I was kind of, when I was younger, very shy, didn't care for public speaking, would never do this, I'll tell you that. But I never had to oversee anyone. I never knew what that really looked like. So I had the opportunity to do trainings, to do all this kind of leadership things, to try to get more engaged, to try to pull myself out of my comfort zone and do something new. So I think that really helped me as a person, you know, as I went through grad school, as I got my doctorate, keep pulling myself out of that comfort zone and trying new things. And if I fail, guess what? You fail. You do something else. You keep pushing. So I think that's been one of the bigger lessons I learned. And at the time, I'll tell you, it didn't feel like a lesson. It was different. But, you know, looking 10 years back, I'm like, wow, I would never see myself in this position. So, yeah, that's at least what's worked for me.
Yeah, for sure. I mean, Tristan said it, but I'm going to take the approach that I said before, where it's your people skills. Your EQ has to be unbelievably high. Specifically, I'm sure you see this a lot, is someone could come in there having the worst day of their life, or you could be having the worst day of their life, but guess what? That client, that patient, they don't care. They don't care. It's their best hour of their day. And so your people skills and your ability to communicate clearly, to provide positivity, be very energetic. Obviously, I'm intentionally working the room here because that's what I do, but it's also just like, hey, like we're hanging out here. Let's feel comfortable. Let's ask better questions. And so getting really, really good at doing that will also move your career along very forward because people want to be around you. And when people want to be around you, that is a skill set, and that is what's going to also help you advance a little bit.
And I might be going off from the question, but be authentic, be yourself. When you're not being yourself, you can like feel that, right? So I've been in a bunch of meetings where someone's trying to act a specific role. Sometimes that role is super professional. Sometimes that role is a disciplinarian, but you could tell when they're not being themselves. And and I'm thinking just in like my leadership role, like there's so many times that if you really just relate to someone the way that you would relate to somebody, regardless of your situation,
speaking from the student perspective, at least, one thing that I picked up studying and going to classes is really allowing myself to want to understand and want to be at certain places. Kind of ties into what was said before, but your attitude going into things, where sometimes I'll be in my A&P class and an insane topic was just brought up and I have no idea what's going on. But I really try and reiterate the fact that I want to understand. I want to be able to be good at this thing. And although wanting something doesn't necessarily always translate to getting that thing, but it's always going to be the first step in getting towards that thing. So I'd say that when it comes to working, understanding cash registers or knowing how to move a knee at the PT clinic, I'd say it's that, honestly.
Shout out to Dr. Emmanuel there. Teaches our A and P to basically everybody in this room, that type of thing. Good, good. Any questions from the audience here?
Howdy everyone. My question is just more about performance analytics. I personally think it's a very fascinating field. What would you guys say is like the 5 to 10 most important things to track? More kind of like suggestive or more measurable types, like a resting heart rate, or just like I wake up, my leg hurts today, I'm a little sore. What would you guys say is like a couple most important things to track, or is it more kind of different for every person that goes or whoever you're training?
From my experience, it's really going to be specific to the group you're working with and what you're able to get. You know, you can do a lot of things with a lot of things, right? So if you know how much distance someone is running while playing on a field, and you can track that during games and practice, we have a measurement of what that looks like. If you're working with, like you track the field athletes and looking at distances, that's a whole nother thing. If you don't have any measurements, we can act subjective measurements like RPE and use that to track training load and to really, over time, you can get a picture of what's happening with their health. And, you know, that's one of the things that the field is looking at is how can we reduce injury? What are the markers of reduction? You know, if they get to this training stress balance and it's really high, should they be training really high? Or is that going to, you know, make them fatigued and tired? Or, you know, for college athletes, does that make you sick? Does that make you get injured in the middle of your season because there's just so much going on? So I don't think there's a gold standard measurement. It's really going to be dependent on what sport you're working with and then what's important for success in that sport.
Yeah, I don't think there's much else. I would ask you, like, what do you track right now yourself?
I know for me, I'm big on my sleep and all that. And,
Okay.
You know, I just had my tonsils out a couple months ago, so I was sick constantly. So I always find it fun, like, tracking my heart rate. It's like, oh, it's about 5 beats higher today. I'm going to be sick in about 2 days. So it's kind of learning stuff like that and kind of seeing my HRV, tracking my sleep, and, like, if I had a bad day of sleep, okay, let's see how this run is going to go today. Let's see how it spikes. Like, I know I had a great night of sleep yesterday, and now I ran about a minute faster. My average run was about heart rate about 20 beats lower than usual. So I always think that's kind of fascinating to correlate sleep to my heart rate to how I'm going to train that day a little bit stronger and all that.
Yeah, I think one thing with data is, even though if it's not super accurate, like you have these wearables and Whoop bands and Apple connections, it's like the degrees of accuracy, you could probably attest to it a little bit more, but like they're not 100% accurate. And we did a combine for like a professional group of athletes, and we had them do those analytics. And one thing that ended up happening is the human psychology gets attached to those numbers, and you end up not performing as well as you can because you're constrained by the number itself. And so what happens is if you, like for you personally or anybody, is if you're looking at your metrics and they're not perfectly accurate, but you're still using it as a way to gauge your performance, there's still some correlation there, right? So it's like if your sleep score is not perfect or your recovery score on the Whoop is not perfect, but it's like, hey, when it is a little bit better, I do feel better. But back to what doctor said over here is that you don't want to be tied to that number, because like I was wearing a Whoop band for like 2 years, and the days that it said my strain was the lowest, I had like the worst training sessions. And days where like my strain was high, I was like hitting PRs left and right in the gym. So it's like, what's the underlying psychology behind that too?
Hi, I'm Josh, also an exercise science major. For someone looking to get into physical therapy or athletic training, what advice would you give for getting your career started?
I recommend, well, I mentioned before, observation. So whether you're doing student volunteering, you're getting an internship, or just doing observation hours, that would be my first recommendation. But get a job as a rehab aide in the setting that you think that would be the best, because what I'll tell you is when we're looking at resumes, we'll see a lot of new graduates who have experience in that setting, and it certainly, puts their resume at the top of the pile.
Also, sorry, there is a difference though, I'm gonna have you, so I'm saying there is a difference though between being an athletic trainer and being a PT. Like a big difference. Does everybody know the difference between like an athletic trainer and PT? Because sometimes that's important too, whereas we have interns and they come in and they're like, yeah, I wanna do this, and I wanna do athletic training, and it's like, this is what it is, and like, oh, I don't wanna do that. So I think just knowing the difference sometimes is important as well. But. Thank you.
You mentioned multidisciplinary. What do you think are going to be the other disciplines? Because this is obviously a growing field. What are going to be the other disciplines that are needed?
I think it depends on the scenario. So I hate to answer it depends, but it does, right? So I'm picturing in like the pediatric department, one of that I run, we have different interdisciplinary clinics where we'll have speech therapists and feeding therapists in with GI doctors, in with dietary, in with lactation and NICU feeding specialists. That's like one group, and then we have like another group for like a hyper tonicity kid, and that's going to be more your physiatrists, your brace clinics, and again, I'm thinking in terms of peds, but I think it depends when you try to picture. Where I spoke before about concussion, you're going to need sleep doctors in there. You might need pain or definitely physiatry, and that's where you see a lot of athletic trainers partnering to get people to return to sport. So I'm picturing in terms of the PT model, but there's also, once you get through the rehab, what do you do after? Because it's always a lifelong thing, right? Exercise, lifelong. So a lot of people in PT, they do their program, you give them a home program, and they don't do it, and then they come back. So knowing that you're handing that off to somebody who can help continue and facilitate, whether that's health coach or personal training or exercise phys. So I think each scenario would be, it depends.
I agree.
And something I have also seen, because my wife, who I think is watching here, she's worked in the field as well. And Tyler, you were there, right, what she did? She came in, she did a bunch of rehab exercises. So her background, when we lived in Kentucky, she was a director of rehab at a chiropractic clinic. She transitioned into massage as not spa massage, but more clinical type, really working on, working the muscles and then creating a plan of exercise to get movements better. So these are routes that we don't typically think of because there's lots of misconceptions about other fields. But when you look at what the benefits of some of these are as a holistic model, we can address physical things, not necessarily at a PT or at a higher setting, but at other settings for more maintenance. And if we can do this, if we can, obviously have the knowledge that, okay, this is something that's good for us, but maintain that, I think overall we can really improve our, working with each other in a holistic setting.
Great questions, everyone. I think that we're going to wrap there. So let's give a round of applause for our amazing panelists.
Thank you all for tuning in and engaging in this wonderful discussion hosted by our very own Dr. Bianca Wenzel, moderated by Tyler Robinson himself, and of course our guest speakers, Dr. Gabriel Martinez, Adam Menner, and Dr. Kristen Reifel. For more information on anything involving St. Thomas Aquinas College or our STAC STEM programs, please visit their website. And if you are a student on campus, please do not hesitate to reach out to any professor of exercise science or in the STEM program for more information. Thank you all for tuning in and watching this panel discussion on exercise science and health innovation transforming modern wellness. I look forward to seeing you all soon. Thank you.